Good afternoon, and welcome to the final panel of this Leadership Academy, the ethics panel. I am so happy to introduce Dr. Marcia Riggs, the J. Erskine Love Chair in Christian Ethics at Columbia Theological Seminary in Decatur, Georgia, and she will moderate this panel of distinguished ethicists.
Starting to go on.
This has been an excellent conference. And so I just want to give kudos to Dean Towns and Dr. Smallwood and everyone else who has made this virtual conference a success. I'm grateful to moderate this panel of my distinguished colleagues. And here's the way we're going to proceed. I'll say a few words about how I entered this discussion and therefore the kind of framework for this panel. Then I'll introduce the panelists in the order in which they will present. And then after we've heard from each panelist, some opening remarks, there'll be some dialogue between the panelists, hopefully. And then we'll open up conversation with those of you in the audience. When I come to conversations such as this, I am reminded of the anger and fear that are anchoring our political and religious life. And that anger and fear has warped our sense of how to be moral community. Political and religious discourse is both uncivil and confrontational. And whether we're political leaders holding a party line or religious leaders holding a doctrinal line, there is partisan polarization. At the heart of this polarization, I like to talk about there being an absolutist morality. And political and or ecclesiastical convictions based in an absolutist morality have these features. They're binary, they're rigid, they're non-empathetic, and they're non-adaptive. So two big moral kind of positions come out of this and are certainly rearing their ugly head during this pandemic discussion. One is us against them because they are evil and we are good. And yesterday, Professor Lee skillfully took us through the toxic fallout of this kind of posturing when he moved us from Trump's use of the term the China virus to the scapegoating of Asian Americans, to racial violence against Asian Americans, to bigotry and his word, political nastiness. The second position is one of binary certitude. Even if dependent upon an illogical causal relationship between the binary assertions. Professor Metzel, who also gave a presentation yesterday on his research with men in particular, and talking about those who were chronically ill, researching and having a dialogue with chronically ill white men who oppose the Affordable Care Act, although they're working, they're poor, they could benefit from the Affordable Care Act. Their reason for opposing it is they don't want their tax dollars to help Mexicans and welfare queens. So here we are in a culture of absolutism where exclusion is the norm by which all other values and practices of community, all ethical priorities are being ordered. And when this norm of exclusion not only describes what is distinctive about a community, but when it becomes prescriptive and says that there are some people who are forever outside of the community and or because they establish a boundary of exclusion, and they may even determine that some groups within the community become expendable because they somehow do not fit how the community has defined itself. So our failure of moral community distorts and therefore circumscribes what we know about justice, or the scope of justice we want to have in terms of equality and justice and love. So what might happen, though, if we tried to think about diverse images and positions as not just oppositional and mutually exclusive, but what might happen if we were to understand that these diverse positions and images that we hold don't have to cancel out one another, but that we can dialogically generate moral community? Why not perceive our positions as differing interpretations that we might mediate? What does it mean to generate and facilitate authentic moral community? So I'm inviting us to think about, in terms of this notion of living in a culture of an absolutist morality, I'm asking us to enter into my womanist moral imagination, shall we say, and think about how moral community can be constructed through intercultural encounters in which we acknowledge and respect the particularity of our differences, particularly the relevance of our different bodies. Let's abandon, as Professor Washington named for us, the hierarchies of human bodies, that we acknowledge and respect that every encounter is one that is contextual and historical, that it has happens in relation to a past, a present, and a future, and that we acknowledge and respect the biases of our own interpretations, and then dialogically, purposefully, and intentionally engage one another in constructing ethical responses. So whereas the culture of absolutism is marked by certitude, the practice of moral community in my womanist moral imagination is marked by constructivism. So in my moral imagination, what we have to do is open up the space for moral community as beloved community to emerge. So given that broad framework of living in a culture of moral absolutism, I have invited these panelists into a discussion that has three foci. One is the rhetoric of the pandemic, such as language such as essential and non-essential workers. Two, the impact of that rhetoric, how it has fundamental consequences in the real world, what populations, for example, are considered at risk or vulnerable, and even what populations fit into a kind of death calculus. When we talk about an acceptable number of deaths or whose deaths count. And thirdly, to think about the ethical reasoning that can inform policy decisions that follows from the rhetoric, or the rhetoric currently in place and the rhetoric we now need in light of the various questions that are before us. So I have asked the panelists three broad questions. What's characteristic of the issues and divisions in the public discourse during this pandemic? How have these issues or divisions been exploited by politicians, religious leaders, leaders of corporations, journalists, news pundits, or social media influencers? And three, which is, I hope, the question that we'll all play with together, what is our message to leaders in all of these sectors of our life together as we move through the continuing pandemic and move into the future? Some speak of returning to normal, others speak of moving into a new normal. As an ethicist, I'm asking my folk, how would you like to direct this conversation? Is normal an ethical category we want to embrace, Or what ethical idea, principles, and or values do you propose to guide us through and to the other side of the pandemic? Now, a little bit about each of our panelists. I invite you to read the program booklet for full descriptions of these folks. Reverend Dr. Emilie Towns is the Dean and Carpenter Professor of Womanist Ethics and Society at Vanderbilt University Divinity School, becoming the first African American to serve as Dean of the Divinity School in 2013. Among the publications of hers that will probably undoubtedly inform remarks today are her Breaking the Fine Reign of Death, African American Health Issues, and a Womanist Ethic of Care, and her groundbreaking book, Womanist Ethics and the Cultural Production of Evil. Dr. Christophe Ringer is assistant professor, is assistant professor of theological ethics and society at Chicago Theological Seminary in Chicago, Illinois. He received his PhD in religion, ethics, and society from Vanderbilt University. So he's back home. He is the author of a forthcoming book entitled Necropolitics and the Religious Crisis of U.S. Mass Incarceration. Dr. Victor Anderson is the Oberlin Theological School Professor of Ethics and Society at the Divinity School. He is also a professor in the program in African American and Diaspora Studies in the College of Arts and Sciences. Dr. Anderson has published 3 books, all of which will probably come into play somehow, arguments from them. Beyond Ontological Blackness, an essay in African American religious and cultural criticism, Pragmatic Theology, negotiating the intersection of an American philosophy of religion and public theology, and Creative Exchange, a constructive theology of African American religious experience. And last but certainly not least, Dr. Stacey Floyd-Thomas is the Lena B. Carpenter Associate Professor of Ethics and Society at Vanderbilt University Divinity School and College of Arts and Sciences. She is a past executive director of the Society of Christian Ethics, co-founder and past president of the Society for the Study of Race, Ethnicity, and Religion, and founding executive director of the Black Religious Scholars Group. Her work in Christian ethics has a threefold focus: race, gender, class, and she's equally interested in the challenges of religious pluralism, social justice, and the political world. She's concerned with what she calls the why crisis of faith, and that is exemplified throughout her numerous publications. Most recently, the book entitled The Altars Where We Worship, the Religious Significance of Popular Culture. So I now invite my colleagues to share their opening remarks. Beginning with Dr. Towns.
Thank you, Dr. Riggs. It's good to be with you all. I want to do a particular shout out to Teresa Smallwood, who conceived and found a way to bring this conference into being with an incredible team. And I'm just sitting in amazement. So thank you, Teresa. Your vision brings us together. I was intrigued by the questions you gave us, Dr. Riggs. And then I became a little afraid because what you're asking us to do is actually think about creating a community that is moral. And we don't seem to be very good at that as individuals or as groups of individuals trying to make communities. What I started to think about was a guiding image I've been using now for the last several years, and that is the fantastic hegemonic imagination. It's in my book, The Cultural Production of Evil, you mentioned, but what this image is all about is that it conjures up worlds and social structures that are not based on the supernatural, not based on fantasy, but on the very ordinariness of evil. And it helps to hold systematic, structural evil in place. What happens with this imagination is that it feeds on stereotypes, stereotypes we all hold about one another. So this is not a one-way street where a certain guest, a certain group suddenly gets to be the victim, the ultimate victim. No, this is an imagination that is within all of us. And it's dependent on these stereotypes we develop and we repeat. And if we repeat them long enough, we will start to believe that they are true. So one instance of the fantastic hegemonic imagination is what happens when we assume that Black ill health is because Black folk are lazy or prone to illness or don't care or don't listen or aren't interested in being healthy. And we repeat this over and over again until we no longer question our assumptions. And we have instead a tendency to move to alternative facts and post-truth, those things that we used to call lies, but now they have fancy words. But we turn to these lies and we don't think that we have to then look further to see, is there a system in place behind the terrible numbers that you see? And it's only brought to light in technicolor with this pandemic. Black mortality in COVID-19, or as I like to call it, the corona, is 3 times higher than white folk. But we don't stop to think about the fact that in some Black communities, there may be no doctor's offices. Therefore, the residents don't see doctors on a regular basis for something as basic as wellness care. It's not only the health delivery system may be broken in some communities, in some Black communities, and also poor communities across the color spectrum. It's not that it's just broken, it is non-existent. Battling a pandemic with no consistent healthcare system in place, while folk in these communities may be disproportionately holding jobs that do not allow for remote work, only makes matters worse. But instead, we look at individual acts rather than the system that is holding it in place. So for me, as I looked at your last question to us, one of the things that I think we need to be very serious about getting into place that we do not have in place in a very systematic way is we need national leadership that is informed, moral, strategic, resourceful, and has the will to actually end the pandemic rather than make excuses for its existence.
Good afternoon. A huge thank you to Dean Emilie Towns and to Dr. Teresa Smallwood for this invitation to return to my alma mater and to be part of this distinguished panel. It is not an exaggeration to say that we are living through an apocalyptic moment. Apocalyptic in the religious sense of an unveiling, or dare I say, an unmasking. It has unveiled our legacies of racial eugenics and social Darwinism, while simultaneously forcing us to acknowledge racism as a public health crisis that has plunged our nation into a full-blown political struggle over whose lives can be sacrificed. Also unmasked is our profound refusal to acknowledge that pandemics are always biopolitical events, where there is no way to truly untangle the science from the politics, that they have to work together. And this refusal has been aided and abetted by bad faith political ideologies that reject uncomfortable truths and embrace pleasing falsehoods, even unto death. The most pernicious of which quickly became entrenched as a choice between saving lives and saving the economy. This moral framing, unfortunately, has endured with the steady drip of false binaries that distort more than describe and conceal more than clarify. One of those has crystallized into the rhetoric of essential and non-essential workers. The material effects of this rhetoric became clear as an electrician, Kirk Gibbs, reported to the New York Times that he's essential, quote, to the pocketbooks of the rich contractors and essential for spreading the virus, but that's about it. Or the MTA conductors who are required to admonish passengers to wash their hands every 15 minutes while not having access to soap and water themselves. Mayor of Las Vegas, Carolyn Goodman, offered up her city as a, quote, a control group for experimentation in a city that is 45% Black and brown. The moral rhetoric of essential workers effectively designates persons and populations upon which our politics can impose sacrifices and withhold solidarity. Those previously unseen are recognized without reciprocity. And this designation is also profoundly gendered, as 1 in 3 jobs held by women have been deemed essential, with women making up nearly 9 out of 10 nurses, nursing assistants, pharmacists, and 2/3 of grocery store checkouts and fast food counters. However, such framings also present an opportunity to leverage important critiques that can forge new moral frameworks and claims. The Reverend William Barber, in a Washington Post op-ed, rightly named that now is a time to acknowledge that food, shelter, healthcare, financial security, clean air and water, and communal belonging were essential prior to the pandemic, and we are long overdue for our national priorities to establish that citizens should not go without them. I also want to argue that the language of essential workers exposes and contests the long ideological legacy of stigmatizing certain populations through the rhetoric of dependency. The language of dependency has long been a central theme in debates around the welfare state, inequality, and poverty. It is one of the ideas through which social inequalities are framed as a result of moral failings and psychological pathologies, especially as it is often framed Black women as so-called welfare queens, bad mothers, as well as Black men as animals and criminals. This language of dependency has its corollary in the rhetoric of independence. Independence, a term originally applied to social entities such as congregations or nations, traveled to men who owned property and could live without laboring. With profound economic, political, and historical changes, independence and dependence became racialized, gendered, and continued to serve as perennial political fault lines. In this moment, it is not enough to recognize our gratitude for essential workers, but to acknowledge our profound interdependence with them, and with populations long stigmatized for being a drain or parasitic upon society. The legacy of this binary of dependence and independence is also a window into the legacy of medical apartheid. A key thread that runs through Harriet Washington's book is that Black people are seen as lacking the independence and necessary capacities to make decisions about our bodies, to interpret and express our pain and our needs. The connections that Washington draws between the risk factors of COVID-19 and environmental racism reveal it is no mere coincidence that the protests of police brutality are also occurring during this pandemic. Here I want to invoke Ruth Wilson Gilmore's definition of racism as state-sanctioned or extra-legal production and exploitation of group-differentiated vulnerability to premature death. As such, policing contains and punishes the social consequences of inequalities that lead to disproportionate suffering and death of Blacks and other persons of color from COVID-19. As such, it is precisely those communities that will have a disproportionate influence and contribution to the medical knowledge and expertise that emerge on the path towards a vaccine. It is often said that the Republican Party is a death cult. I think this is incorrect. Rather, what we see unmasked is the perennial logic of white freedom predicated on the subjugation, suffering, and death of non-whites in general and Black folks in particular. This is partly why we are seeing the images of masked persons of color risking their lives to protest anti-Black state violence, while unmasked white militias protest state houses for the right to go to bars, gyms, and their freedom of movement. A major moral challenge that we face is that the coronavirus humiliates our ideologies of freedom and liberty that deny our interdependence. Moreover, the virus exploits our inequalities, but it does not limit itself to them. So we are in desperate need of a vision of social solidarity. Given our cultural divisions and under our current political conditions, I have no illusions that such a solidarity will be the product of shared affections, a national sense of purpose, or merely the tug of social or civic responsibility. Rather, to break the stranglehold of our politics of death and the historical weight of medical apartheid, this moment may require something more basic and bare bones. I think we need a vision of a solidarity of recognition in a way that makes mutual self-interest constitutive and mutual self-preservation constitutive without the need for deep ideological agreement. No plan can eliminate risk or the possibility of death. We can, however, work towards preserving as many lives and livelihoods as we can. And in the multiracial nature of the protests around police violence, there are glimmers of possibility that we might find the solidarity we so desperately need. Thank you.
Okay, how do I start?
Dr. Anderson, you're good. We can hear you.
What's happening? Am I on?
Yes.
Okay, good. All right, thanks. I too want to thank and appreciate the work that Dr. Smallwood and the team has done and bringing this all together. I celebrate with my colleagues in ethics and society, and I'm happy to join them in this conversation. I want to start with a phrase that is notorious. It says, "It is what it is." This is the words of the President of the United States in response to the death toll of Americans in the United States. It is what it is, as I read a short story, a report from the Journal of American Medical Association from May 2020. The African-American daughter of one of us called from New York City in early March, worried about her Hispanic partner's health. Did his high fevers, worsening shortness of breath, and painful cough indicate coronavirus disease 2019 infection? Given his history of asthma and hypertension, was he at high risk? What should they do? Urged to seek medical attention, he resisted. The nearby affordable and accessible urgent care clinics were staffed by physicians who, based on his previous experiences, just didn't get it. And he anticipated that his concerns would be dismissed. When he relented and requested a coronavirus test, he was asked about international travel, but not about their small apartment or his use of public transportation. He was told no test, once again, confirming his impressions of an uncaring system. He decided to stay at home and tough it out, but he got worse. The fevers were unrelenting, and it was hard to breathe. He was finally cajoled to try a different clinic. There, the African-American receptionist conveyed their concerns, and the staff agreed to provide a COVID-19 test. The patient was handed a flyer with home care instructions, but no one asked about financial consequences of staying home, and no follow-up plans were provided. Then, good news. The clinic called and reported that the test was negative. Yet a week later, the high fevers continued. They reached out to the clinic again and were reassured that there was nothing to be done for coronavirus, unquote. When they asked why the nurse was labeling him a COVID patient, but his test was negative for coronavirus, the response was an unapologetic, "Oops, you got the wrong result." Now, a month later, he is still recovering from COVID-19 and from another painful healthcare encounter. It is what it is. It is what it is. As of this morning, the news media reports that Black Americans represent 74% of total deaths in the US due to COVID-19. In New York City, as of April 7, Black and brown people accounted for 72% of deaths, though making 29 and 27% of the population in that city. In the city of my own upbringing, Chicago, Black people make 32% of the population, but account for 52% of nearly 5,000 cases and the tragic is 70% of COVID-19 deaths. These stats are replicated across states such as Michigan, Louisiana, the Carolinas, and in Milwaukee, Wisconsin. Black people make up 26% of the population, but comprise 81% of deaths in that city. According to the American Medical Association, similar stats obtained among Spanish-speaking populations. Over the past few days, we have entertained considerable environmental factors contributing to these numbers, including poverty conditions, low-paying jobs with no health or you-pay health insurance, the necessity of working frontline jobs, euphemistically called essential workers, which really means disposable, as in expendable. People depending on mass transportation or whose living conditions make social distancing impossible, and who come to COVID-19 with a wide range of underlying health risks. These things and more compound the tragic state of Black and Brown Americans confronting COVID-19. I find myself standing tragically in the place where once stood an ancient prophet, a prophet overlooking a valley of dry bones, lamenting, yet pessimistically wondering with a faint hint of hope, can these bones live? Ezekiel's question was about bringing the dead back to life. But Ezekiel's question presupposes a scenario where his dead results from their own moral failures to keep faith with God. Thus, only God's forgiveness can restore them to wholeness. But this is surely not the scenario surrounding the 74% of Black and Brown deaths due to COVID-19. And to insist that it is represents a morally grotesque and distorted mind that would dare to attribute to COVID-19 Black and Brown death tolls any moral failure on their part, and it amounts to blaming the victims. My question is not so much, can these bones live, but how shall we then live responsibly with one another? How shall we then care for one another? What makes these ethical questions, and not necessarily theological ones, is that the matter at hand is really in our hands as moral agents. Now, it is true that my faith definitely informs my motivations to care for others. I'm also quite convinced that God is not hidden away, out of sight, and thus silent in the face of COVID-19. But the theological question for me is this: how does God come forth as God, not in Ezekiel's religious situation of dry bones coming back to life, but how does God come forth as God in our religious situation of the COVID-19 pandemic that as of today in the US counts 74% Black and Brown people dead of the total 160,000 dead in the US? God shows up. God shows up in and through our powers of agency. When we keep faith with God through works of love and the creative potency of direct care. This is an urgent matter that is made even harder where gross indifference occupies our governmental institutions. And as we hear from the President of the United States, in light of US death tolls, it is what it is. Yet, marshaling moral activism based on an all-comprehensive responsibility to care in this context seems stalled by pervasive cynicism, governmental indifference, weakened sabotage institutions, and incompetent national health management. Still, the impossible is so very necessary. I was recently asked in an interview this question: what insights do you feel the Black church in the US could examine as they reimagine their faith and religious practices during COVID-19? I responded, well, there are many church leaders who seize this moment, this religious situation, as a test of faith in God's providential concerns. And so keeping faith with God means staying the course, worshiping together, and to not be like the world, which is fearful, distrusting, and God despising. I must admit, if this is what care looks like and how God's come forth in this situation, you can have it. So I continue, however, saying, I am reassured that there are other leaders who have taken this opportunity to display divine creativity by modifying public worship by way of Facebook, online, live streaming, and YouTube. They admonish the faithful to show what care looks like in this crisis. Care for one another, for the community, and the public at large. This is what care for neighbor looks like: wearing masks, observing social distancing, washing hands. This is what care looks like when safer at home is, for this moment, the new golden rule. While we must marshal our powers of care in ways that challenge our national institutions to intervene proactively to combat COVID-19, as moral agents of care, we cannot and ought not to push totally on national coordinated means between public and private organizations the entire burden of care. But as individual moral agents, keeping faith with God on earth means caring for the corner on which you live. That's right. It looks also to the local for participatory care through organizing efforts, seeking neighbors or listening from neighbors, those in need of intervention, cooperating with local services, city and county, as well as not-for-profits, for ways to get involved, assessing community needs and volunteering. And most urgent, as we navigate this religious situation, we must use every individual power of agency available to us to get out the vote as we witness to our keeping faith with God on earth. The scripture asks, when the Son returns, will he find faith on earth? The answer is yes. When God comes forth as God in and through the power of our moral agency to care for one and another. Thank you.
Good afternoon. Thanks to our esteemed Dean Towns, Doctor and Attorney at Law, Teresa Smallwood, one of my earliest Womanist muses and mentors, Reverend Dr. Marcia Riggs, and my esteemed colleagues, Christophe Ringer and Victor Anderson, for affording me the opportunity to join this circle of faith in the midst of death-dealing circumstances. My brief remarks are entitled Shelter in a Time of Storm, Reclaiming 2020 Black Faith as a New Sanctuary Movement. And it's a nod to my forthcoming anthology entitled 2020 Hindsight, The Racial Realities and Religious Significance of COVID-19. The collective failure of the national imagination to grasp the roots of American inequalities, which the rampant spread of not only COVID-19, but also COVID-45, that is Donald Trump, has exposed various sectors of American society to compounding social ills. These viral inequalities have resulted in injustices that lay behind the massive wave of sprawling lines outside food banks, polling centers, testing sites, and state unemployment offices, as well as the ever-expanding protests against racial violence. While COVID-19 does not discriminate according to racial and ethnic differences, the virus certainly has done a phenomenal job of adapting itself wholeheartedly to America's longstanding legacies of social inequality, especially the country's inhumane disregard of marginalized communities and oppressed peoples. This reality limits historical possibilities to stark, seemingly draconian options, often presented as if they represent the only alternatives to combat a rising tide of infections and related deaths. Now, arguably, this pandemic is an opportunity for us to reconsider the relevance that Black faith in particular has played in the spiritual, physical, and psychological health of what Maya Angelou once called these yet to be United States. In The Souls of Black Folk, you all might recall that W.B. Du Bois wrote that Black churches, quote, are differentiating now into groups of cold, fashionable devotees, in no way distinguishable from similar white groups save in color of skin, now into large social and business institutions catering to the desire for information and the amusement of their members, warily avoiding unpleasant questions, both within and without the Black world, and preaching in effect, if not in word, unquote. In his groundbreaking treatise on Black religion in modern American life, Du Bois prophesied more than a century ago about the societal as well as spiritual crises we are now facing as Black women, men, and children, whose supplication to a colonizing, whitewashed religiosity potentially leaves us prone to the erasure of our own bodies, minds, and souls. The threat and throes of this pandemic have Black Americans in particular envisioning themselves as refugees of both church and state. On the one hand, they're being forced to leave the fortification of their fellowship in their sanctuaries while fleeing to a more profound sense of faith, due not only to the life-threatening consequences of the coronavirus, but also amidst the heightened deadly conditions brought on by the racial animus at the crosshairs of the pandemic and racial conflict. Now, in both cases, clergy are mounting ministerial movements by seeking to link divine justice to social justice. This time of pandemonium is an opportunity for us to not simply look at the fantastic hegemonic imagination that Dr. Towns brought to our attention again, or to look externally in regards to what Dr. Floyd-Thomas said earlier and what Dr. Ringer just mentioned as the necropolitics that we are facing, or to Ebony Marshall-Turman, who earlier spoke about the necrotheology, but it gives us an opportunity to look internally to how Black lives matter in regards to its prosperity, posterity, and progeny. Thus, we need to consider how the multiple yet merged COVID-19 crises have reawakened the activist vision of what we might consider a sanctuary movement. Much like the hush harbors, the Underground Railroad, and other historic segregated enclaves and subversive endeavors, the ways in which they brought together spiritual courage and secular concerns, this modern day sanctuary movement once again relies upon the spirituality of an invisible institution led by fierce-driven people to save Black lives. Particular in this regard is how, as one example, Womanist work and witness has led and liberated Black faithful leadership, vis-a-vis one, the radical subjectivity of those Black ordained and self-appointed social media saints who have commandeered virtual pulpits and overflowing streams of liberation theology, testimonies, and worship, such as the likes of Ernita Weems or Claudette Copeland, Martha Simmons, Melva Sampson, Irie Sessions, and so many others. Or secondly, the traditional communalism of those women who made a way out of no way, taking to the streets and transforming political platforms more for the people and less for their own aggrandizement, such as the dynamic duo in the Dean, as well as in our fierce leader in giving meaningful leadership to this racial justice collaborative that foreknew to convene this actual workshop and conference before this crisis began. Or the three women of the Black Lives Matter movement who established that movement long before George Floyd and Breonna Taylor's state-sanctioned police killings took place. Or the Black female mayors across this country who have remained vigilant visionaries of some of the nation's largest cities, which have become COVID hotspots, Trump targets, but still remain wells of resistance for people, male and female, young and old, straight, trans, and gay. The redemptive self-love as the third example displayed by celebrities who are deemed role models not due to the conspicuous consumption of their craft, but because of their courageous character in their art, as displayed by Ava DuVernay, Janelle Monáe, No Name, Her, or Beyonce, among many others. Last but definitely not least, the critical engagement of emerging womanist scholars ranging from Melanie Jones to Tamura Lomax, to Ebony Marshall-Turman, Connie Marshall, and so many others who have shown brilliantly and bravely that this work is incarnate to linking divine justice to social justice, pathos with logos, wounds with witness, and hermeneutics of suspension with sister sanctified street sense savvy. Now, these womanist moves meant to spring from and flow over into the street front centers and mega ministries that wrest Black faith from shallow, sterile, and stultifying religion that emulates mainline ecclesiastical bodies while undermining social cohesion and self-definition based on a real palpable racial identity and real religious heritage. This sanctuary movement of sorts is a response to stay-at-home mandates and racial hostility that has made the faith of Black people resurface in subaltern spaces as a way of providing both asylum and alliance in face of a country and an appalling response to a lethal virus that by all indications not only affirms that Black lives don't matter, but seeks to annihilate Black lives. Moreover, many of the churches that got blindsided by COVID-19 have now become faith allies, finally. This movement, although absent of brick and mortar, is a virtual stream of Black faith that is palpable, not only because it's soul-stirring, but because it is life-saving. This alternative vision of sanctuary contemplates a pragmatic value of providing safe haven for Black Americans made vulnerable by a rogue virus and a racist society, and now seek both the sacredness of their higher power and the sanctity for their bodies, and to overcome dispowering, disquieting, and devastating circumstances of the existential threat waiting outside of every door. Countless traditionalists have had to redefine the very notion of what was holiness and what is holiest and most sacrosanct about live, face-to-face worship experiences. No longer are the rites of communion and confession and congregational fellowship needed to be in person in order to allow new practices now for the promotion of human flourishing beyond glass ceilings and stained glass ceilings, to explore what it means to strip people away from the safe space of convenient, comfortable worship and transfer the essential work that is not disposable, yet devout, the work of faith by coming to terms with how the church unchurched, and non-religious alike have converged during this period to reflect a fluidity of faith. This fluidity of faith focuses the study of Black religious experience on the intricate complexities of the quotidian. By paying attention to the ways that homebound Black people deploy their moral agency in a fashion shaped by the nuances of racialization and religion as it is being coalesced and contested on a routine basis. Much of this work is done by paving over the fractures and fissures of the fragmented world outside the lockdown and left out. As pastors, preachers, professors, physicians, and participatory community-minded folk, we must extend and expand a meta-ethical approach to more fully comprehend the new worlds, the new golden rules, as my colleague Victor just said, and ways of faithfulness that are coming into existence because rather than in spite of their seclusion from the real world, we are becoming relevant. All of this has the unintended consequence of promulgating the collective scale and scope of Black sacred experience that was once only individual theological formation. Ultimately, this movement offers us a time to emphasize that the transition from brick and mortar ecclesiastical spaces to virtual houses of the holy signifies the essential work that our souls and minds must now envision. Ways that make the natural conditions and consequences sparked by COVID-19 or COVID-45 spring forth new profound manifestations of spiritual witness, scholarship and service that saves not just souls, but might in fact save actual lives in the process.
Wow. You all have all said a lot in a very short period of time. There are so many places we could go. How about, I don't know, I was just thinking about highlighting particular phrases or ideas that truly stood out within your presentations that almost might also lead us to some further conversation. Professor Towns gave us some very real characteristics of national leadership: informed, moral, strategic, resourceful, and the will and commitment to actually end the pandemic as steadfastness. Dr. Ringer, I was particularly drawn to your way of pushing us to look at the apocalyptic in terms of its real meaning of unveiling and unmasking, and to push us then finally to talk about what a solidarity of recognition might look like. And of course, Professor Anderson and the call to a moral agency of care. Certainly, that's what loving our neighbor is about, but we seem to have forgotten it. And here we are in the middle of a pandemic where we certainly need to find it again. And both reminding us that it's going to be the ways in which we as individuals and not just the systems respond to all of this that's going to save us. And lastly, Dr. Floyd-Thomas, wow. This push to make us examine what it is to be a new sanctuary movement as the Black faithful rather than just the Black church, you know, pushing us to get outside that box we've put ourselves in by being, quote unquote, the Black church. This whole call to be virtual houses of worship that where this real creativity is happening, and how it is not simply a response to the pandemic, if I heard you correctly, but is actually the next call to be the church, or to use a term. So new practices, you say, for promotion of moral flourishing. That's what's at stake. So, and the push to look internally at how we believe Black Lives Matter. So all of you have given us various places we could go to either look again or more in depth at what's going on in the larger outside community to which we're responding, and or to go internally and look at what we're doing as Black folks to actually make a difference in the midst of this pandemic crisis. So where do you want to go? Anybody? I gave you time to think.
Well, I think one thing for me that runs through the entire conference really is the way in which it's something I ended with, but we've all touched on the lack of national leadership to organize and galvanize us, and then the temerity to throw it to states that don't have resources to begin with,
Right.
to solve not just an epidemic, but a pandemic.
Mm-hmm.
And it's another form of blaming the victim.
Mm-hmm.
We just haven't used that language yet, but people get sick because they didn't do something right, as opposed to a lack of a national health care plan that's non-existent can't help us, can't wait it through. And so all of the things that we know to be true about the brokenness of a system or the non-existence of a system are just being brought out in boldface. And the different ways people have learned not to care about each other are being brought out in boldface. And interestingly enough, the ways that people do care about each other are being brought out in boldface. The question is, which face is going to win for me?
Yeah. And in a climate where we certainly get caught up in issues of economic expediency, it gets even more complicated. Which face will win?
I think also, especially the work for us as ethicists on this panel. I think what Emilie and Victor made very clear was that our work, whether it's in the academy or in the church or in community organizing, insists that we be explicit about what lies are and who's telling them, and what love looks like and what it now demands. I mean, I think that's a genius of both of what Dean Towns and Dr. Anderson were saying. And as Dr. Ringer was saying, that is what necropolitics, right? That's what governs the economy of our life and death. And so our agency is caught up in that balance. Who are we to be as individuals? Who are we to be as institutions? And as people of color, because of our the ways in which double consciousness has not only been negotiated or a sense of code switching, but to harken back to Dr. Anderson's early work, it has become our ontology. We can no longer switch or be compartmentalized. That our life and our livelihoods depend upon us having a sense of norm clarification, as Katie Cannon would have said, to say with whom do we stand?
Yeah.
And our actions have to line up along those lines. And that's where we find ourselves.
Yeah, it's a moment we definitely have got to come out of hiding.
Right.
I think I'm really taken by Dr. Anderson's concreteness in terms of care, but also Dr. Floyd-Thomas, the kind of bursting forth of new ministries in virtual spaces, that really does contest the kind of resignation of it is what it is.
Right.
Right. And I think that was a very powerful moment for me, the kind of normalizing at the highest levels of government of it is what it is, that kind of fatalism. But we can really do have the agency to contest that in our communities with these new ministries. And something I've been thinking about a lot is I think there's a moment for Black churches to be in relationship with the community rather than to symbolically stand in for it.
Yeah.
And I think the kind of new ministries that are emerging are doing that kind of work. Right? That they're much more relational and invitational without the presumption that it simply stands in for Black people writ large.
Yeah, I agree with everything that I just heard. It's just a kind of sobering reminder to us what ethics is about and what ethics matter. It matters about agency, really, doesn't it? Too often we are so quick to put the whole matter on God. Come in, God could do it. Won't he do it? Of course, yeah. I accept that. That's okay. But sometimes we confess that to the exclusion or to the denigration of our own powers of agency. I really am convinced that where God is, God will show God's self in what we do. And so it's really depressing to every day to wake up to the news. The media is so overwhelming, and it's easy to fall into a sense of cynicism. And as Michelle Obama confessed today, even depression. But we can't afford that. The urgency is too great. So my great hope through this conference and through this panel is that we can remind ourselves to intrinsically motivate ourselves to do the work of care. And even though we may be stalled by many structural barriers, we still have the corners on where we live. I think that's an important reminder to why I think ethics matters in this urgency.
And I would just like to note that what's so wonderful about the space that Dean Towns has brought forward and brought to life is the insistence of doing intergenerational work in human flourishing. Because the fact of the matter, I mean, as Eddie Glaude questioned in his provocative essay before, is the Black church dead? If we were to look at the midst of what we're suffering now with COVID-19 and COVID-45, if the church has been saved, it has been because of the millennials who literally have saved churches that were floundering, who did not see technology or social media as not only relevant, but in many ways evil and sinister, right? That they have soldiered and they've stepped up to the plate. The way in which women, women who've been on ministry because they weren't able to have brick and mortar churches, they have flourished. So the institutions and the people who have flourished or saved dying institutions have often been the people who've been left out and left behind previously. And that's a telltale sign. And people are flocking now to, as we see the rise of Black women leadership, to the people who have been doing the work all along without needing the praise of being called leaders. And that's something that has been intergenerational. It's the sign of our future and our flourishing as faith-filled people.
Well, we've been told that we're to bring this to our final thoughts. Does anyone have a final thought? Or else I will give a final thought before they cut us off, because I think they're going to cut us off.
You do it, Marcia.
Okay, I think it's important truly that we own this call to be intentional moral agents, that's the task that lies before us. And I know that I deal with people every day who have a theology that has God so far out there anyway, that they would never be able to be called into being and action by that God. So the fact that we know that God is in the midst of us and we're being called to do this work here and now is, as you all have said, is what's going to save us. I thank you all. It's been great seeing all of you and being with you.
Thank you.
Thank you.
This panel is now over. We thank you all for joining us, and you are invited to join the processing salon that follows. Thank you.